Hi, Assalamualaikum. I am Fatehah. In this video presentation, I will talk about tiptoe walking. So, let's get started. First of all, I will start with the definition. So, tiptoe walking or toe walking involve walking on the toes or forefoot without using their heel strap. So, toe walking is common in children who are learning to walk. However, after the age of 2, most children outgrow toe walking and begin to walk with a normal heel to toe pattern. So, in the next slide, I will show the example or the illustration animated video of how children usually toe walking. However, if the children continue to toe walk after the age of 2 years, it may be a sign of an underlying medical condition, such as short Achilles tendon. This tendon links to the lower leg muscles to the back of the heel bone. If it's too short, it can prevent the heel from touching the ground. Next condition is cerebral palsy. Toe walking can be caused by a disorder of movement, muscle tone, or posture caused by injury or abnormal development in the parts of the immature brain that control muscle function. Another condition is muscular dystrophy. Toe walking sometimes occurs in this genetic disease in which muscle fibers are unusually prone to damage and weaken over time. This diagnosis might be more likely if your child initially walked normally before starting to walk. And lastly is autism. Toe walking has been linked to autism spectrum disorder, which affect child ability to communicate and interact with others. There are many complications connected to toe walking. Here are some of the examples. Persistent toe walking can increase a child's risk of falling. For example, they tend to lose their balance, hence, they may easily fall. Next, pain may arise as they grow into adulthood. When they usually persistently to walking, their muscles will be tightened, hence, they may feel pain. And moreover, they may have difficulty participating in sports or other recreational activities. For example, when they to walk, their muscle tighten, hence their movement will be limited. And lastly, it can also result in social stigma. For example, um, when people see the children have this condition, they people will probably judge or conclude that they have some medical condition. For children who are 2 to 5 years old and able to walk flat-footed, initial treatment is always non-surgical. For example, serial casting. Doctor may apply a series of short leg walking casts to help progressively stretch and lengthen the muscle and tendon in the calf and break the toe walking habit. Serial casting is usually performed over a period of several weeks. Next is bracing. Wearing an ankle foot orthosis can help stretch and lengthen muscles and tendon. Typically, bracing is performed for a longer period of time than casting. It takes about months rather than weeks. As you can see, here are the examples of serial cast and bracing. For children over the age of 5 years old, the calf muscle and Achilles tendon may be so tight that walking flat footed is not possible. The doctor may recommend a surgical procedure to lengthen the Achilles tendons. Lengthening the tendons will improve range of motion and allow better functions of the foot and ankle. The full recovery time takes between 3 and 6 months, depending on the child's unique circumstances. Always follow the doctor's instruction. In the next slide, I will share with you a video of one uh, sample case of children with two walking condition who have done or undergo uh, this this kind of surgery.
Hi, I'm Dr. Michael Jarman with Pediatric Foot and Ankle, here today to discuss toe walking in our children. This is an 8-year-old little boy. He has severe toe walking. He's exhausted all conservative care with splinting and bracing and physical therapy and the watch and wait. He is pretty bad. He's not able to even get his heels down to the ground. He's had this his whole life. This is not an issue that's just suddenly happened and he started toe walking. He's just never been able to walk normal. These kids struggle a lot with fatigue and pain. The majority of these kids that are this severe have an anatomical variation in the back of their leg that don't allow the Achilles tendon to grow and lengthen normally over the years. And it creates this tightness, this rigidity in the ankle joint. This is shown here because this he's asleep and I'm about to do surgery here. And as I flex his ankle, you can see it's just completely locked up. This is 6 weeks after surgery. I lengthened the Achilles and I removed that anatomical abnormality. And immediately what you notice, so this leg obviously hasn't been done, but that right leg, you immediately notice is that there's a restoration of the range of motion within that ankle joint. These kids don't have pain post-operatively after this. They're guarded, and you can see here, this is week 6. He was in a cast for 4 weeks. I then transitioned him into a boot for 2 weeks, and then at 2 weeks, we actually want them coming out of that boot and back into regular shoes. And then the other leg, we'll stage that 2.5 months out. Now, in some of these kids that are really severe, like he is, we sometimes will move up that surgical date on the other foot. Instead of waiting 2.5 months, we sometimes will move it up to 2 months, just so that we can get them moving along a little quicker. But they have to be staged 1 foot at a time. So you can see here is 14 weeks out. Both legs have been done. The correction is very pronounced, or it's really good. You can see that he has kind of a, I won't say heel toe, but he can actually put pressure on the heels, and he's able to try to walk flat. We typically are having them do physical therapy immediately post-operatively to help increase range of motion and desensitize. Here's 5 months out. You can see these surgical incision sites. This isn't normal, by the way, when we look at these incision sites. They're typically even. He had a variation on the back of the leg, making one surgical incision site just a little bit higher than the other, but they're typically at the same height across the legs. But what's important to notice here is that his gait is completely changed. He has now a more normal heel-toe gait. He's still guarded. Every child, again, is very different. Some of these kids don't have much restrictions or much limitations when they start to walk, and then some do have a little bit of a slower progression. This kid's a rock star. He's doing awesome, just killing it. So 5 months out, I mean, he's walking like he's never walked like this ever in his life, right? We saw how bad he was here before surgery. He could never even get his heels down, and now then post-operatively he's able to get his heels down. Just, it's life-changing for these kids. If your child toe walks and you'd like to explore a pathway to correct their toe walking, whether you're here local or out of state, feel free to give our office a call. We'd love to help. I'm Dr. Michael Jarman. Thanks for watching.
So that is all from me, and thank you for listening.